Good afternoon, everybody, and welcome to this afternoon's webinar, Coping and Problem-Solving Strategies for Youth with ASD and Related Disorders. Today I have the honor of welcoming Linda Maytons. Today's presentation is coming from the Rochester Regional Center for Autism Spectrum Disorder, located here at the University of Rochester's Strong Center for Developmental Disabilities. And before we get started, I'll just touch on a little bit about our RRC ASD, Rochester Regional Center for ASD. We are one of 7 university-affiliated centers here in New York. We cover those 12 blue counties in the Finger Lakes region, and we're dedicated to community education and technical assistance surrounding ASD and related disabilities. Feel free to check out our website. We do have some resources on there, as well as we'll be posting today's recording and handouts from this afternoon's webinar as well. Just some quick housekeeping before I pass it over to Linda. Feel free to use your chat box if you have any questions, comments throughout today's presentation, and we'll have some time at the end to discuss those. Following today's webinar as well, you'll receive in your email a link to a satisfaction evaluation survey, and we really welcome your feedback and any suggestions on how to improve our programs, our webinars, and any topics that you might like to see in a future webinar or information sheet. We welcome that as well. And if you require a certificate of attendance, you have the opportunity in that survey to request one of those, and we'll send you one via email. So without further ado, I'd like to introduce Linda Maytons, who's part of our Strong Center for Developmental Disabilities as one of our fantastic behavior specialists in our community consultation program. So we are in for a real treat, and thank you so much, Linda, for joining us.
Good afternoon. So I'm hoping to go over some general things related to coping and problem solving, but feel free to let us know if you have some questions or comments as we're going along, and we'll be sure to make time for that at the end. So a couple things. So some factors that are influencing coping and problem solving. So some core areas, communication and issues with communication, both receptive and expressive. But more specifically in terms of feelings, wants, and needs. Also information processing. So many of our individuals with ASD and related disorders have difficulty understanding social situations or being able to follow and also commit to social rules. Primarily because they have limited experiences or opportunities and don't get as frequent feedback from peers or friends as more typically developing individuals. Social experiences also can be varied in terms of their personal preferences and some self-restriction in terms of what they're comfortable experiencing and doing, and what may be some preferences or some more ritualistic or stereotypic types of needs. There's also errors in interpretation, or at least differences in how information and how experiences get processed. And also, as many of you know from the environmental standpoint, there can be sensitivities or differences in how environmental factors are experienced. One thing to note, research suggests that anywhere from 47 to 84% of individuals with ASD can experience some form of anxiety or worry. And so this becomes a major factor when we're talking about coping and developing coping skills. So some common behaviors of coping, and these tend to not be sort of typical. So withdrawal or avoidance, refusal or escape, repetitive patterns of behavior such as rhythmic fixed patterns of vocalizations or statements, motor movements that sometimes don't seem to have specific purpose or are difficult to identify with a specific purpose, may in fact be a way for individuals to cope. Vocal and motor stereotypy, and this varies with individuals. Some individuals may actually engage in more scripted statements, more repetitive sort of games or movies, things that they have been watching or listening to, and those might be indicators of things that are stressful and ways for them to sort of cope and deal with those things that they're being asked to do and or participate in. You may see intense attachment or very strong preferences for things. An example might be, we have a young person right now that I'm consulting to the school team with that has a very strong attachment to various stuffed animals or any type of animal, whether it be sort of plastic and that. And this definitely appears for that individual to be a source of comfort and a way for them to cope with transitions and novel situations. Last but not least, ways of coping may also involve challenging behaviors. So you may see anything from self-injury to aggression to property destruction, and basically sort of tantrum or acting out behavior when things become stressful. So generally I'm finding that there are two main ways to intervene. One would be to sort of manage the situation or manage the environment or manage the actual items that are becoming the stressors. So another way to look at that is making modifications. However, just simply managing doesn't necessarily translate to providing the individual with adequate replacement skills. So the other form of intervention that is necessary is also looking at the replacement behaviors and very specific instruction for those replacement skills. I'll talk a little bit more later about the need to also identify functionally equivalent replacement skills, particularly when you're talking about those challenging behaviors. Because you don't want to just teach sort of general coping skills. You really want to identify what is that want and need, what is actually going on with the individual so that you can adequately select the replacement skill. So what I thought might be helpful is to have you take a minute or so to look at this example and to think about what would be an appropriate modification that one would do, and then what would actually be the specific sort of longer term coping skill that you would want to make sure that you replace the behavior with. So the first example that I used was an individual consistently has difficulty when it is time to stop a highly preferred activity. So I'll give you just a little time to think about that. So I prepared some outcomes for that. So things that I have typically observed is under the management category, the classroom or the family may limit when the individual actually has access to the highly preferred activities. Or another management strategy might be to provide time limits, which would actually be the length of time that the individual is able to actually engage with that particularly highly preferred activity. So maybe, times of day, how many times they can have access, but also the length of time. And again, using visual and auditory timers to indicate when the time would be up and when they would have to transition away from the highly preferred activity. Another way of looking at it would be to provide some anticipatory cues in preparation for the individual at very specific intervals. And that tends to be very individual. So I have one young person now that I'm using a 5-minute, a 2-minute, and a 1-minute anticipatory cue, basically warnings that the preferred activity will be done soon, but giving them ample time to sort of prepare. But these would still be considered sort of the management strategies. So the actual replacement skill then would be the individual would be taught to either ask for more time for the preferred activity. And again, you'd want to specify how many times they can actually ask for more time or what is the length of time that they could actually render if they asked for more time. So that would all need to be taught ahead of time so that there wouldn't be confusion at the point where they're asking for more time and asking for more time repeatedly, basically saying, I don't want to be finished with this at all. But another skill that's important to be thinking about is to ask or to negotiate for an alternative activity. So if that highly preferred activity needs to be done, then what else can I do? Are there other options? And so the negotiating is actually a higher level skill But that's something to consider for some individuals. The second example I chose was the individual screams and becomes aggressive whenever he is corrected on his work. This we see commonly in terms of when there's errors or when the answer to a particular math problem or writing sample is not correct, and the teacher in this case would have to indicate in some way that there needs to be a correction or trying again, those types of things. So I'll give you another few minutes to just think about what would be the modifications and then what would actually be the longer term coping skill replacement. So again, I gave you some examples. So under management, what I see typically is that adults may actually avoid using the word no, or they don't really want to correct the individual in certain situations. Some other things that I didn't note is that sometimes people find sort of less intrusive ways of noting to the individual, particularly if it's on a worksheet or something like that, that something needs to be corrected by circling the problem or the word, and then just having the individual sort of look at that. One stipulation would be just to not use red. We know that that for all individuals is a suggestion that you wouldn't want to note that something needed to be corrected with red ink. But the long-term replacement actually, because we know that the word no is going to come up in the world at some point, is to teach accepting no, or to teach asking for help when something is difficult. You may also, if you're selecting asking for help, you may also need to teach identifying what the person needs help with, and then even more importantly, the ability to accept the assistance. So what is the first step in developing more functional coping skills? I can't stress enough that the first step must be assessment. And I've listed some of the important pieces that while you're evaluating or assessing what the individual knows and can do, that these are core things that you need to be able to answer before you even select what the skills may be and how to go about actually teaching that. So it's important to determine what are the conditions under which current coping behaviors are observed. And these are the coping strategies that may not be all that adaptive, although they are currently working for the individual. So it's going to be essential for us to actually look at what are those conditions and what purpose are those particular coping behaviors that might be unique to the individual serving. It's also important to determine what are the specific stressors. We want to be very clear in terms of what are the causal factors, because we may actually be able to make some antecedent changes. And those would go under the management strategies. What does the individual already know to do, but may not be applying consistently or even appropriately? So they may already possess some skills that we don't necessarily need to teach, but we need to increase how they're applying them, or we need to shape exactly how are they using them appropriate to these particular situations. It's also important to check and make sure that the foundation for developing any coping skills is solid. And so it's important to look at, does the individual have all the necessary prerequisite skills? So an example is, do they know what they are feeling? And I'll talk a little bit about some of the issues with feelings, because oftentimes our individuals with ASD struggle with necessarily applying to what's actually going on with themselves. So they may be able to identify multiple types of feelings, even some of the higher level feelings. They may be able to do that in pictures and even on others, but really have difficulty when it comes to identifying what's going on with them. And sometimes that may not be our starting point. So how to assess? Oftentimes I find that we just discuss. what we think is going on with the individual and what we believe that the individual can and cannot do under various situations. I'm going to suggest that you always use multiple measures and that you use both direct and indirect measures. So direct measures would include things like you observing the individual under certain conditions, and also, in some cases, even directly interviewing the individual and or directly working with the individual and seeing what they're able to do under certain conditions. Indirect measures would include checklists. I have a few favorites that I've listed in your resources, and some are readily available, and some are actually protocols that do need to be purchased, but I've listed some of the information, and I'll identify some of them in a minute. Using data, if that's available, generally ABC or anecdotal. Frequency data may not give you the necessary information that you're looking for, but at least it could certainly pinpoint some of the situations under which the difficulties are occurring. And then there would be various other methods under indirect that can be used in terms of parent interview, looking at historical information in both school and medical charts. Often I find considerable information in files dating back to when the individual was a preschooler and what skills were being worked on at that time. So I would definitely suggest pursuing that. So what are some necessary underlying skills? So some core things are recognizing the individual's reactions to the events, and for them to be able to recognize what their reactions are, not just us pointing out what those things are. Learning to recognize what their body is telling them. With younger children, I'm sure you're familiar that we've done like check your engine, where we've had them check their heart, is their heart beating, are they feeling sweaty palms? And to really kind of work on what's going on from their body, what's being communicated in terms of whether this is a comfortable situation or something that may be more stressful. And then identifying situations or the actual factors that result in certain feelings. So teaching feelings beyond identification of emotions. So one of the things that I often find is that even those individuals that learn feelings and can identify feelings on themselves, they then don't know what to do with those feelings. So thus the coping skills. So again, making sure that they have some sense of what am I feeling? What does my body feel like? What does it feel like when my feelings are changing or getting worse? Oftentimes, we as observers can see that things are either becoming less comfortable or the individual's becoming more agitated, but it's really important to focus on, does the individual themselves notice those changes? What are those core things? And some of those things are going to be internal and not easily observable by the outsider, by the adult or the instructor who's trying to get a handle on what the person is feeling. So spending some time seeing what the individual can show us or tell us. What are some signs? What are some things that we can key them into, even from our observations? And then what are the situations that make the individual feel a certain way? And so I have sort of made an informal list. This is certainly not all-inclusive, but I tried to give you some examples of some things that would be important to take a look at, not only in the instructional time, but also during the assessment time. So here are some verbal and nonverbal instructional support examples. So there's various, and today you can go online and you can get just about any type of anger and emotion scale, or at least get ideas so that you can develop one that's very individualized for your student or child. The thermometer, and I'll show you some examples in a second. The volcano is one of my favorites, but I do have a caution. We don't want to indicate that the volcano erupts. we want to use different terms. We certainly don't want to create sort of this notion of that we want the escalation or that we want the outburst as sort of the final result. We just want to talk a little bit about an eruption, so that it's kind of bubbling. Another favorite activity and has been very effective in not only teaching the coping skill, but also teaching some of the awareness that I was talking about earlier in terms of what goes on with the person. So I've used the game operation and help the individual sort of relate what their body might be telling them just by playing the game. And again, with the focus being on coping skills, but also on translating what's going on with that particular character during the operation game and his body. And then also the game of Jenga has been very helpful in actually putting certain skills and certain situations right on the blocks that are used for Jenga, and then discussing what happens when the tower falls down and all those things. And there's many, many other games that can be used at different age levels and at different ability levels. Chutes and Ladders could be one that could be converted. Even the spinners can be very effective in putting various situations and various coping skills on the spinners, and then practicing using the spinner and identifying what those situations are. Pictures or graphics using favorite characters, and probably something that you're very familiar with is Michelle Garcia Winner has the Superflex and the Unthinkable characters. And this can be very useful at all ages, in fact. I have some older teens that are in a residential treatment facility that we were using that as a general instructional tool, and they were actually really enjoying and learning from being those characters and then sharing that information with their same age peers. Actual photos or diagrams of facial expressions and the body, or what the body might be experiencing. I'm sure that you're all familiar with the zones of regulation. So there's many tools, including the incredible 5-point scale and the anxiety curve that sort of coincides or correlates with the zones of regulation. And I'll talk a little bit more about that in a minute as well. Video model is definitely being found to be very effective, and we have lots of opportunities. I would just suggest screening everything before using it. There's lots of things available online and YouTube, but screening is essential. I have found that sometimes there are some things that are not necessarily appropriate. I've also included some websites and some information and also some visuals for you. There's a game that you can purchase that's called Talk Blocks, and it's almost like dice. So there's one die that is about how one feels, and then the other die is about how the individual, what the individual may need. And that can also not only serve to be a way for the individual to communicate to you if they don't have verbal language, but also a way to create different scenarios to practice. And then I included an app, and actually from my alma mater in University of Minnesota. So the Autism 5-point scale app, and I'll show you a little bit why I like that a lot, because it can really be customized. It can be put on an iPad or on your phone. You can take a picture of the individual and actually have them at the various stages of upset, but you can also add their voice or someone's voice in terms of what the feeling is or what might be going on in terms of being upset or frustrated, but also what the coping skill. So it can serve as a prompt even. And I have a couple of individuals now that have it on their iPads, and they're actually now reminding themselves when they're at certain stages of what the coping strategy should be for that particular level of upset. So I added a bunch of different visuals. There is just an infinite amount of tools out there, all of which can be customized. I am a little technically challenged, but I do believe that if you touch on these on the slides when you receive them electronically, that you will then be able to actually go to the site and you can PDF them. So I just selected a bunch of different ones. You see that there's some zones of regulation, but there's also various 5-point scales, all of which can be customized to the individual. So here are 2 examples of the thermometer, and I put these 2 examples on because I wanted to point out a couple things. So a lot of times we communicate to the individual where they are in terms of their sort of their state. But I really feel very strongly, and if you look at the one on the left, I believe my left, that one also has not only the sort of state of being, but also has very specific things that the individual can do. So if you are using a thermometer, it shouldn't just be us communicating to the individual sort of where they're at. It really should be about us instructing right off the bat about what are some options that they can do to not only implement at those various heightened states, but also how to maintain the sort of calm or good state for that individual. What are some of those things that help them be able to stay on green or whatever the color is that connotes that the individual is doing great, that they're on track. So some more examples. The one thing about the zones of regulation, and so I know that most people are familiar with them, so I didn't add a site for those, but those are readily available, is that I'm finding that we're sort of generating the things that the individuals can do rather than really assessing what are the things that are going to directly and functionally replace the current coping skills. So I like these 2, the blue and the yellow example. I like these 2 because it not only indicates what's going on with that individual. So in this case, the blue zone is really not a heightened state. It's actually that the person's sort of running kind of slow, not really engaged, having trouble kind of getting started. And then some emotions tied to that. Either the person might be sad, or they might be tired, or, gee, this activity is so boring, I can't take it anymore. Or they might be feeling ill. And then some strategies that are directly related to each of those states. So when you're using the zones of regulation, I really can't impress upon you enough that it should be individualized and not really some of these generic things that we tend to pull out, but really part of your assessment in terms of what does this individual understand about these things, about these various states, and then what do they already know how to do, or what do we need to teach them that's going to help them? Here's the University of Minnesota app again. I wasn't able to load this so that it was actually workable. And the other thing, this is a selling point, and I don't get any rebates from them. I'm just very excited because a lot of my kids that I'm consulting to are using it, is it's free. And I've included the resource at the end of the slides for you as well. And I love the fact that, yes, on the left side, it comes sort of prefabbed with these sort of figures, but actually they can all be changed. And you can add various photos. It doesn't always have to be the individual's face themselves, but it can be something that's really meaningful for them. I love the fact that it has an auditory component because it actually can say what the feeling or the situation is. And then most importantly, I love that you can actually record the coping skill. And so when we're looking at how are the individuals that we're teaching these skills to not going to be reliant on the adult, we're looking for increasing their ability to use these skills independently without prompts. And so this one's been really effective in doing that. Here's the example of the talk blocks that I talked about earlier. I did include the site for this, but there may be some difficulty accessing it for whatever reason, because there's many other sites that are using the same terminology. So I actually included the picture for you so that when you are looking online, that you know exactly what to look for. Here's just some more visuals in terms of when the individual needs help. This would have been really nice to go along with my other example, where we're going to be teaching it. And then we're very specific about what the help is going to look like. So we might initially say to the person, looks like you don't understand, but here's what you can do. You can reread the instructions, you can ask a friend, or you can ask a teacher or an adult for assistance. And the same with frustration or being stressed. Some very core things, again, that are individualized for that person. You can walk away or ignore, and many of us find that strategy to be difficult, but it is a strategy. I can ask for a break, and I do want to say something about break. Oftentimes, break is confusing to individuals, and I prescribe to sort of making sure that a break is something that one does so that one can sort of get reorganized, so that they can come back and they can sort of persevere or continue the task, rather than that a break is to simply get away from something. So for those individuals that may have an escape or an avoidance function to some of their already learned coping skills, you want to be careful that we are explicitly teaching break as a way for the individual to get organized, that we're very carefully selecting the things that the person does during break. So this would not necessarily be a time to engage in a highly preferred activity. You'd want to be engaging in something that's going to help you get back on track so that you can continue your day or continue the activity. And then last but not least, again, asking for assistance. And at some stages, clearly adult assistance may be needed until the person has actually learned or acquired the skills. I have included an example of what I have put together for a few youngsters, which is a progressive relaxation program. Again, if you go online, you're going to see many different options in terms of progressive muscle relaxation and all of this. This can be very useful, and also what I'm finding is that it really does help individuals not only just learn to cope with the situation, but actually it's something that they can do proactively to even get ready to do those more challenging tasks. So this one is something I've put together. Certainly it's not anything that's published or anything. You're free to use it. What I generally do, again, is I will assess, because our individuals are going to have some difficulty isolating certain body parts. And so when you're looking at progressive relaxation, you're looking at a tensing and then a release of that tension in that particular body part. So the first step that I usually do is I just take a look at what can the individual actually do. Most individuals, even more typically developing folks, have trouble sort of isolating the various muscles on their face. So you may say, I just want you to squeeze your eyes, and you see the whole face being scrunched. So again, I start where the individual is at. And then I've also found that I sometimes can make some modifications that's just for that individual. So I have a young lady right now that I'm working with that has great difficulty sort of with her lower body. So from the waist on down, and even the waist is sort of the stomach area has been difficult. But for her, the one thing I really wanted something going on lower in terms of sort of that tensing and flexing, and then being able to feel the release going all the way through her body. So rather than having her actually be able to tighten her thigh muscles and that, we've started by her putting her hands together and then putting them between her knees and then squeezing her hands. Not in a painful way, just enough to get that sensation, and then to count and gradually release. And that's going to be the other issue too, is making sure that they're holding the tension for a certain amount of time. I like 5. I like the count of 5, but it doesn't have to be. It can be less or it can be more. But then also releasing slowly that tension at that same rate. The other nice part about the progressive relaxation is that if you select these things carefully for that individual, this is something that can be done anywhere. It can be done right at their desk if they're in a classroom. It can be done in a restaurant while they're waiting for their meal to come. So it really is something that's pretty unobtrusive and very personal to them, and it only takes a few minutes if done correctly. And then it can be portable. It can be taken anywhere because it involves their ability to tense and release various body parts, and it doesn't look odd. Yoga is another one that's very effective, but again, if you were to get up and do a downward dog in the restaurant, people would find that unusual. But that might be something that you could do in the privacy of your home, or even in a location in a school environment. But it's not something that you could necessarily do individually in the classroom. You couldn't stand up in the middle of math class and engage in yoga. But progressive relaxation, you can. A simpler form of just teaching breathing would be the square breathing profile here that I've included. And again, these things are infinite. It's really about finding the thing that's going to be effective for that particular child that you're focusing on. So I want to talk a little bit about most folks, unless they've been specifically trained, are not going to be able to do formal cognitive behavioral therapy. But I included a couple things that are under that umbrella. And so one is cognitive picture rehearsal, where basically you're working on changing the person's thinking about the situation. So this is an example of where the issue is that there's a sudden change in routine. I've also used oops as a way to teach that sometimes things happen, and that's also a nice way to teach flexibility, where proactively you're doing those oopses or those changes when the person is not at a heightened state, when they're just simply learning that sometimes things change. But then adding under sort of the cognitive behavior umbrella, adding some thought-changing statements like, I can breathe and relax or listen to music and then I'm fine. So it's okay. It's not a problem. So social stories can certainly complement, or social scripts can complement these picture rehearsals as well. A little bit more complex would be the cognitive restructuring. So I just included sort of a table for you to use or to copy when you're thinking about doing some cognitive restructuring. So you'd have to identify what the thought or worry is. So I have a young lady that I'm working with right now that she hates reading. And so that would be her thought or her worry. She's also worried about that she's failing ELA. And her feeling actually is, when I met with her, is she's angry. She doesn't understand why she has to take these stupid courses that are very hard for her. And she really feels very strongly about that. So a replacement thought for her might be, and we actually discussed this, and she said she was going to try it. She did tell me that she tries to do the reading, and I said, that's good. So you can simply say, I may not like reading. I tried to use the word like instead of the word she used, which was that she hates reading. So you may not like reading, but you're trying. And in fact, you are great at math. And so getting her to really be thinking when she's going to ELA class, when she's going to reading lit, actually is the class that she hates most under ELA, is that, yeah, you may not like that, but you're going to give it a try, and yet you know that you're really good at something else. And then the action or the feeling that she's going to be working on is a calmer state, so not being angry, and then trying, and if it's hard, immediately asking for help, not waiting until she's at that anger state. And again, this is something that was very individual. The example I gave you is very individualized, but this is pretty infinite too once you know sort of what goes on with the individual. And if the individual isn't able to tell you, you can certainly use pictures and other ways to get the individual to communicate to you what might be going on in terms of that thought process or that worry. So cognitive restructuring under the umbrella of cognitive behavior therapy, not formal cognitive behavior therapy, but some strategies under that. So let's talk a little bit about some coping strategies for the feelings. So we've talked about some of the relaxation strategies. We've talked about changing the way the individual is thinking. There's some other strategies that I've used that I like flipping the pancakes, basically, thinking differently about the situation. Social behavior mapping is another strategy that can be very useful. I'll talk a little bit more in detail about problem-solving curriculum and problem-solving solutions. I love social autopsies to really dissect situations and get to the root of the problem, and then to come up with some options in terms of how to address the problem. Solution organizers are basically graphic organizers that you help the individual identify what the triggers are and then what actions they can take to sort of mediate or mitigate the triggers and the feelings around those triggers. And then there is also an app that I've included, which is the Cognitive Behavior Therapy Referee. And that's an app that's available as well. So what are some issues with expressing how one feels? So many individuals may not be able to identify on themselves, as I said earlier, verbally or non-verbally, what they actually are feeling. I oftentimes get a lot of, I don't know, or I get something that I'm really struggling with identifying what could be a viable coping skill. It really makes it difficult for the individual if they can't get a sense of what's going on with them to really know that things are changing, that their body and their emotions are changing from one state to another. Thus, again, earlier I talked about that it's really important to try to see if we can teach the individual in terms of, do you notice when it's changing, when it's shifting, when all of a sudden you were feeling really okay and then all of a sudden now you're not, because that's that point in time where they can use the strategies to mediate and not get to an agitated state. So that's a very important part. Makes it difficult for others to be aware when something is being uncomfortable. So for those folks that are working or living with individuals, if you're not able to sort of see what's going on, you're not going to be able to know when to provide a prompt or to provide support. So it definitely makes it difficult. What I want to stress, though, and actually this week alone for some reason I've had to skip over on a couple of occasions with individuals, that it may not be a necessary step for all individuals to achieve knowing how they feel. What we may want to do is we may want to actually go right ahead into identifying what they need or what they want at given times, and really focusing on, can they identify the situations? Can they identify some core things that occur, subjects, as in the case of the young lady that I was talking about? So reading lit is a situation where we know that she's going to have difficulties, even if she can't identify what her emotion is at that time. So coping with feelings or identifying the situations, either or is fine. Both are even better, but if you're not able to necessarily assist the individual in acquiring the skills to recognize their feelings, then at least go for seeing if you can identify what the core situations are so that they can then associate what we might see as far as their presentation to those situations. So the actual steps or strategies to change the situation really involves the way that they are thinking, and usually are very specific to the individual. So sort of generic things, again, when I'm talking about sort of the zones of regulation, we don't want to just teach some of these generic coping skills. like, Jane and Bob are all gonna, take a walk. You really want to take a look at what is going to assist that individual in really returning to a calm state. So talk a little bit about problem solving. Very much, we're talking about similar issues related to the characteristics associated with autism spectrum disorder and other related disorders, including all developmental disabilities and learning issues. So you're looking again at social understanding, interpreting others' actions, responses, taking the perspective of others, and then applying learned skills, and applying some form of self-regulation or coping. Instructional approaches also are very similar, with assessment being the first step. So you need to know what the person knows about actual problem solving. Can they identify what the problem was? What broke down? What was the issue? And then what occurred in terms of the very specifics. So I have some favorites that I like to share with people. And oftentimes I find that we teach sort of this notion of good choice, bad choice. And even if we don't use the term bad choice, we are sort of focusing on, did you make a good choice? And what that doesn't do is it doesn't teach the process of problem solving. It just simply sort of gives a description of whether or not the choice that the individual made, or the actual strategy that the person picked, whether or not it was, in our sort of definition, something that we felt was appropriate or not. But that doesn't render the individual being able to learn how to really think about their actions and be able to sort of predict, if they were to select a particular action, what is the outcome of that action? So I have a favorite, and I apologize for the fact that this is very blurred, but I wanted to leave it so that I didn't forget to cover this. But if you go to your resources, you can actually click on the SOCS link, and you will be able to download all the worksheets and all the materials very easily, and they won't be blurred like this. So this is an example of a birthday party. But I'll talk more specifically about just sort of the core areas. So what happens is, we want to teach the process of problem solving. And so we want to teach all choices have consequences. And then we want to take a look at all of those options, even the ones that you may not think are appropriate for the situation. What is the outcome of that? And in fact, the one thing that we often miss is that a lot of times the choice that we're saying was not a good choice was actually very effective for the individual. So just to give you a very simple example, so I had a young person that I was assessing, and I asked him why he hit the teacher. And he said, because she was in my space. And I said, oh, and what happened? She moved. And so in that particular example, hitting the teacher, although perhaps not appropriate for the school setting, or hitting anyone being appropriate, actually was very effective for the individual. So what the person struggled with understanding was that, why did we say that wasn't a good choice? Because it worked. Other things that come in to play when we don't teach the process of actual problem solving is, we don't teach sort of foreshadowing, which most of us have the ability to do this. We might be sitting at a meeting, or we might be talking to a family member, and before we say something, we might be thinking about, how are they going to receive that information? What might be their reaction to that information? And that's the part of the problem solving that doesn't get taught when we simply say, was that a good choice or not? So I like the SOCS problem solving curriculum. It's actually a curriculum available. Brenda Smith-Miles, we actually hosted her here several years ago, and I had the opportunity to talk to her about some of the the issues with sometimes using this as an instructional material, and I'll share some of those with you. But basically what you're looking at is you're looking at generating the situation, all of the options, all of the things that actually might have occurred, including the one that the individual that you're suggesting that was an error, that was a social error, but including that one as well. And then really looking at what was the outcome or the consequence of each of those options. And then looking at all the choices around those options. And what are some plausible strategies? And then actually doing a simulation. And if time allows, you want to simulate all of those. And then here's the important piece. You want the individual to rank. You actually want the individual to rank whether or not that particular selected choice was effective, was appropriate for the situation in terms of the acceptability of that action for that particular setting, because we certainly have some things that we might be able to do at home and not in the community, or maybe we do that at school, but we can't do that out in a restaurant. And then really having them understand sort of the process of decision making. If we don't do that, they have great difficulty with generalizing. So today, hitting the teacher was not a good choice, but gee, when I did that on the playground, it was effective and nobody said anything. And so I'm not necessarily translating that same instructional piece of that we don't do that, isn't translating and isn't generalizing to other areas. I also added a visual that's a circle of control. I think this is an important piece when you're looking at both teaching coping skills as well as problem solving. Things that the person can control and things that the person can't. So what's in their control? What are some things that they can do? What are some strategies that they can use? And what's absolutely not something that they can, or any of us can have control over. Living in Rochester more recently, we're all probably thinking we have no control over the weather and or snow days in April. So those would be things. There's nothing we can do about that. It is what it is. And so we have to go on. We have to accept that there's not much that anyone can do. And so this can be a very important lesson as well, to really kind of focus on what we can change, what we can't change, what are some things that have to stay status quo. I also added a scale that looks like a 5-point scale, and it technically is, but it's about how big is the problem? And then what are some viable things that the person can do depending on the size of the problem? Again, when you're doing any work with social thinking, you'll find a lot of strategies that are associated with sort of assessing and evaluating the size of the problem. I think it's just important to always then incorporate that there's many options, and that all of the options in terms of solving that problem have consequences. And which one is the one that really is going to work the best? It's going to work for you, and it's also going to be acceptable to everyone else. And so really having them weigh that out. I like the visual that is about making a list of what pushes your buttons. What's not on this that I think you'd want to work on is also then what can you do when your button gets pushed? This might be a good exercise for all of us to do. So what should you teach? Well, you should always teach functionally equivalent replacement behaviors in addition to those general social behaviors and those general coping skills. So that may involve, for some individuals, that may involve actually doing sort of deeper assessment, maybe even a functional behavior assessment, which I did not include in today's talk. I know we've had those examples in the past, and we've talked about the various functions. But if you're encountering an individual who's struggling with sort of dealing with novel situations or particular stressors, you're more than likely looking at some escape or avoidance function. But you might also be looking at an individual that is making requests by those behaviors for particular things that they need or want. So it's really important to know what the function of those current coping skills that may not be as adaptive as we would like them to be, but currently are working for the individual, so that we can adequately pinpoint what is the viable replacement skill, because identifying function is going to narrow your selection. And it'll help you in terms of being able to stay away from those general social behaviors, which are good to teach as well, but to really pinpoint what's going to be useful for that individual. The other thing that we always want to be thinking about and planning for is decreasing prompt dependency. Now, individuals that may have some executive function deficits, and we did that webinar, I think, last year, may have some difficulty sort of applying and implementing things themselves. So they may need prompts initially, but we want to be thinking about, that's why I like that app from Minnesota, is that if they can find ways to prompt themselves versus needing an adult prompt or a peer prompt, they're going to be able to acquire those skills to independence much better. So I gave you a little sort of chart here to be thinking about if you're not going to be doing a formal behavioral assessment. Just some questions for you to ask yourselves as you're doing your direct and indirect measures and going through charts and going through information and interviewing people and involving the child. What might be sort of the function of that behavior or the purpose of that behavior? What is it doing for the individual? And then also talking about what are some things that prevent them from becoming upset or frustrated, and then being able to narrow down again what are the skills that you may want to teach. So I included another example just for conversation purposes here. So I have Josie. I was kind of thinking about the cartoon characters, Josie and the Pussycats, but you don't need to. It could be any Josie. Refuses to follow direction when asked to do seat work. Often he will leave his desk, wander, or attempt to elope from the classroom and sometimes the building. So what might be the function? And then what would be a functionally equivalent replacement skill? So I made this one fairly easy for folks to sort of generate some thinking, but you always want to make sure that there aren't some other underlying functions. And then very important part that we haven't talked about yet is how would you actually go about teaching it? And then how are you going to reinforce it? Because what we know is that if an individual has had some strategies in their toolbox previously, and those things have been working for them, it's going to be hard for them to want to change or learn something different, even if you've identified perfectly the functionally equivalent replacement skill. So you're going to need to use reinforcement until that skill actually is viable, until it's really working for them as easily, as effectively as the previously learned, more maladaptive, if you will, coping skill. And then you want to be thinking about what is the coping skill that you want to teach for situations long term. So there may be something that you teach that's an interim coping skill or an interim skill, but what do you want to actually do long term? What are some of the bigger issues? So earlier we talked about that asking for help actually has some multiple features. So there's asking for help, but then there's also being able to ask for help and telling people specifically what you need help with. So in the example of reading, it's that you really need help being able to select very specific answers to very specific questions, and it's really reading comprehension. So it's not just the decoding part of reading that's hard for an individual, it's really being able to pull out what are the most important things. And really, when you're looking at long-term skill development, you want the person to be able to say, I didn't understand this passage, or I'm not really sure what they're referring to when they talk about this because I don't have those social experiences. So again, how are you going to reinforce the longer range skill? Because again, if we don't necessarily get it to work effectively and easily for us right off the bat, we may kind of throw it aside. We all do that when we're learning new skills. So how are you going to reinforce it? And ultimately what you want is you want the performance of that skill to be easily accessible to the individual, and you want it to be effective. And therefore it will maintain on its own, but not all skills do maintain, and you may want to be thinking about how are you going to maintain that skill long term. So when do we teach? So definitely you want to emphasize teaching as part of a proactive instructional plan. I usually try to say to people, we really should be working on this daily and not just waiting for those situations to present, but that we want to be proactive and we want to actually do the instruction when the person is in a calm state, not facing those very specific stressors. Once you've done some of that sort of foundational work in terms of having the person practice those skills in a very calm state, then you want to start thinking about what are those certain situations that are likely to present. I usually like to start with a hierarchy of those situations. I don't want to go in right away with the most heightened state of a situation, but to then be thinking about what are some of those situations where I can actually have the individual practice in vivo, in the real life situation. So what are some of the early warning signs, and when are some of those early warning signs noted are good indicators to possibly, once the person has been able to have opportunities to practice, to sort of begin to inch their way towards being able to apply those. It's not optimal to teach these skills when the person is agitated or immediately following. And oftentimes when I say not immediately following, this evokes a question, perhaps you're thinking it now, with something like the life space interview that I'm sure most of you are familiar with if you've been through TCI training, which is often suggested following a situation. I actually prefer to use the life space interview sort of strategy as something that I build in proactively, or I collect data on some of these scenarios, or I even will sort of develop these scenarios that sort of resemble but aren't directly related to the person's individual situations for those people that tend to be more sensitive, and that we don't want to reignite a situation. So we want to do instruction. And we can't really do instruction when the person is in an agitated or in an upset state. Now, learning is occurring, so we do want to be careful how we're responding to the individual, but that's not the best time to actually provide the instruction. So where should we teach? We need to practice the skills initially outside of the actual situations. We also need to practice the skills in the context that the behavior actually has occurred. Now, when I say context, these might initially be contrived contexts, or another word that people use is sort of that you've planfully begun to sort of sabotage the environment to resemble those contexts, but they're not necessarily right in the heat of the moment. So these are something that the individual isn't going to necessarily know that they've been contrived or they've been sort of set up, but that you are certainly planful about it, and so you know that you may not necessarily get application of the skill you've been practicing, so you may actually end up sort of promoting a slightly more agitated state than what you had hoped for. So this definitely is a planful sort of setup of those contexts of those situations. And then we clearly need to, right off the bat, we need to be planning for generalization of those skills across similar situations, across locations, and definitely across people. So I've seen many times when a strategy is working for the individual when he's with certain people. Those people have become sort of the stimuli for, oh, I can be effective with this strategy, I can do that, and then it doesn't translate to other people or even other locations. So you may get successes at school and not home, or you may get successes at home and not school. just to give you a couple of examples. So how do I teach? I'm always referring to having a plan, like a lesson plan, in fact, or using very specific curriculum. And also, don't forget, you need to know what the individual's learning style is. What is the appropriate modality to teach this? You know, do I need lots of visuals? Do I need to use videos? Do I need to do role plays? Or, oh, this person really doesn't like role plays, so we stay away from role plays. So it's really important to know all of those pieces and to use some plan. You don't want to just throw sort of general coping skills or social skills at individuals. If you are running a group, you want to make sure that the group has similar needs, that you're actually focusing on something that's going to apply to each individual, as opposed to only one individual really has difficulty coping with reading skills, and that's your example. Whereas the other people are just sort of participating, but they're really not getting the sense of how this applies to them. Task analysis of the skill, so breaking all skills down into the smallest components that are necessary for that individual. I was talking to a group the other day about oftentimes we prefer to do sort of total task instruction. So we want to teach the entire skill. And a lot of our individuals that we're working with and we're doing instruction with, that may not be the best method of instruction for them. We may need to break that skill down into smaller pieces and teach it in those smaller increments. Next, you want to identify how to present feedback. Most of the time, even with all of us, feedback has to be delivered a certain way for people to actually want the feedback. And then also reinforcement. And so there's a couple of things I want to talk about related to reinforcement. Generally, initially, because learning how to use better coping skills or problem-solving skills is a difficult task, you're going to want to have reinforcement be fairly immediate, or not just fairly immediate, but actually be immediate. So you perform the task, even if it's during the rehearsal stage or the contrived stage, you want reinforcement to be delivered right away. You want that to be coinciding with the feedback. So, you know, that was almost what, you know, we're talking about. Try it again, but you're almost there. Really a lot of encouragement and very formal reinforcement. As the individual is starting to demonstrate the skill, then you can certainly thin reinforcement, and then a token system might be appropriate. But remember, token systems delay the receipt of the actual reinforcer. So when you're working on these pretty tough skills, you want to be pretty quick about reinforcing, and the immediacy of delivery of the reinforcement needs to be paired with actually the strategy that the person is using right at the moment. Determining the specific method of application too. So how are we now going to take the sort of the rehearsal or the practice skill, and how are we now going to apply it, and what are we going to start with? Are we going to apply it in certain contexts? Are we going to apply it in certain locations? Are we going to apply it with certain individuals? I often like to use peers, particularly more typically developing peers, as the individuals that are not only that we're going to apply the skill during those situations, but also the peer is going to provide the feedback and the reinforcement. Absolutely, you have to collect some form of information or data. You are going to want to use that data to determine whether or not what you're teaching is actually, you know, taking form, whether the individual is able to actually perform those skills, and are they actually being effective, and is it something that is easy for the individual once they've been given those rehearsal opportunities to pull out, particularly at those various heightened states. You're also going to use your data to assess the progress. Best laid plans of mice and men, and gee, this isn't going in the direction that we want. We're going to have to go back to the drawing board again. And then Last but not least, now you're seeing the individual being able to do the skill in practice and perform the skill and apply it during these contrived situations. Now you're going to want to really test the individual's ability to use that skill at the most heightened state. And certainly you can reinforce the skill application even if it's with a prompt. That's perfectly acceptable. So just to recap, so instruction is going to include all of the following. It's going to include some form of modeling, and that if you're a good actor, that can be you or peers. I love to use other peers to actually model the skill. It can be videos, it can be all kinds of things, it can be pictures, it can be picture sequences. There's lots of material available, but I can't stress enough that you're going to want to practice, practice, practice. And with practice, there's going to come reinforcement for even approximations of applying the skill, and feedback, and more practice, and more reinforcement. And now you're ready for some contrived situations, and you've determined your hierarchy of those situations, and you're going to start with the least stressful and work your way up the ladder to the most stressful. And boy, your work isn't done, because I hope you plan for generalization right in the beginning, because we got to make sure that while we're practicing all of this and while we're contriving these situations, that we're thinking about the locations and the contexts and the people. And now you're well on your way, and you're going to really want to make sure that you've been fading out those prompts, or at least you've been giving the individual prompts that they can use more independently. And don't forget, we need to maintain these skills, because if they're not solid, we might need to still intermittently provide some reinforcement to maintain those skills in those tough situations. And remember that just because reading lit is hard today doesn't mean that the next course that isn't reading lit but still is under the umbrella of ELA isn't going to be equally as difficult or even more difficult. And gee, all right, I was doing this in reading lit now, I was applying these skills, but now, I don't know, this is really hard, and I'm back to being frustrated and angry, and I really hate that subject. So you really want to be thinking about independence and maintenance all along. So I hope you have some questions. Valerie here is going to help me access those questions if you do, and feel free to make comments and ask questions.
Great. So folks, please feel free to take the next couple minutes, send us your questions, comments using your chat, and Linda and I will be here to be able to answer those. I think I speak for everyone that, Linda, this is amazing amount of information. So thank you so much for taking the time to share this with us. Folks, we know that within the past hour, we learned a lot. So I want to make sure that everybody receives these PowerPoint slides so that you can reference them moving forward. So everybody will receive a link in an email this afternoon, and that link will take you to where the slides are, as well as a recording. So as soon as those are up on the website, I'll be able to send that to everybody so that you can reference these. And then also feel free to reach out to us, even if you don't have questions or comments this moment, but moving forward, Linda and I are easily to reach. So I do have one question for Linda too. You mentioned how in the beginning of the presentation, how helpful it is to, use ABC data to determine our interventions. And I know there are a lot of teachers on the line today. So do you have any suggestions for how educators could, collect ABC data, and maybe just explain what that is, in our busy days, and how we can do that?
Yeah, well, definitely ABC data is more involved. Usually it looks at what was happening way before the behavior or the skill, and then what transpired once the person performed the behavior or the skill in this case, because we also want to use data to measure the things that we're teaching, not just the problem behaviors. I have a personal sort of tool that I like, which just asks some basic questions in terms of what was the person doing, then what happened, what did you do, and then how did the person respond to what you did or what occurred in the environment. It really just generates sort of a narrative piece. I have seen, and we actually use some of these in our program, that sometimes we can code them so that in each of those categories underlying those questions, you can just select or circle a coded response so that you don't have to write everything out. I usually tell teams that I work with that if something is unique or something is qualitatively different, it's actually better to provide more information than less information. But once we sit down and we talk about the individual and what we're hoping to accomplish, we certainly can code antecedent behavior consequence data.
Great, thank you so much. Any other questions from attendees?
Earlier, I noticed, Valerie, that there were things coming up on the side.
Let's see, let's make
sure. So I'm not sure. I actually saw a picture at one point of a person.
Could be their video. Huh?
Their video.
Yeah. All right, so no other questions in the chat box. Folks, Linda did provide us some great resources here, the last couple slides. Here she references the 5-point scale from Minnesota.
Well, that's actually the one from Carrie Dunn, urine, but it is further down.
Okay.
This site, the e-learning site, has a lot of visuals, clip art things, and a lot of things available. And again, I mean, it's not one size fits all, and I have found that not one strategy is necessarily going to guarantee that there's going to be acquisition of a particular coping skill. Oftentimes, it's a combination of these methods or these strategies. So you might use a 5-point scale, and you might also then do social problem solving, and you may even have, an app that you're teaching the individual to use more independently. You may need to have social scripts and social stories. I mean, these are things that have been covered in the past. So it's really sort of putting together a total package for the individual, targeting the skills that you're trying to teach. So I think further down is the app. There it is. It's on the top,
Perfect.
The Autism
Great.
5-point scale.
Yeah. So folks, feel free to reference these, and these will also be included in the slides that everyone will get. So if there aren't any other questions, I would like to thank everybody for joining us today. And again, we welcome your feedback when you get that evaluation survey link. And if you require a certificate of attendance, we're happy to provide you that. Oftentimes, participants use that certificate to apply for CEUs. So if we could help with that, please let us know. So everybody have a wonderful evening. Thanks again for joining us. We do have a webinar coming up already next Friday in terms of medication. So we welcome you to register for that on our website there at the bottom. And hopefully we'll speak to you again next Friday afternoon.
Thank you, everyone.
Have a good night.